Studies has shown that more and more educational/health professional with highly A-quality background check, often called a thorough or comprehensive background screening, goes beyond basic checks to verify a candidate's for their academic research papers, as public figure for their awareness abilities. Health and educational research studies has shown more important value with A, clear, accessible, and professional ideology. I will give reason why sociopathic personality disorder and antisocial personality disorder are very much the same and much different at the same time. Sociopathic personality disorder, medically known as Antisocial Personality Disorder, ASPD, is a mental health condition characterized by a long-term pattern of manipulating, exploiting, or violating the rights of others. This behavior often leads to conflict with social norms and laws. Like thinking shoplifting is an okay behavior, like thinking this shit belongs to me anyway. May people paid for this with their blood. Here are some symptoms like individuals with ASPD may show some or all of the following traits: persistent disregard for social norms and laws, frequent deceitfulness and manipulation for personal gain, impulsive or aggressive behavior, lack of any remorse or guilt after kicking down or harming others, lack and difficulty maintaining any long-term relationships with anyone, irresponsibility and reckless disregard for safety, like driving with the lights off at night, lack of any empathy or concern for others' feelings, possible history of criminal activity or substance abuse as alcoholic or drug addict of all kinds. Now, these are most of causes of sociopathic personality disorder, are complex and not completely understood. Contributing factors may include genetic influences, a family history of personality disorders, or mental illness environmental factors, childhood trauma, neglect, or exposure to violence or sexual violence. Is any harmful or unwanted sexual act, an attempt to obtain a sexual act through violence or coercion, or an act directed against a person's sexuality without their consent by any individual regardless of their relationship to the victim. Like sexuality, behavioral actively has shown a more developed mental issues, impaired emotional attachment during early life with their parents. Some of the diagnosis is made by a qualified mental health professional through clinical interviews, observation, and review of personal history. According to the DSM-5, ASPD requires a persistent pattern of antisocial behavior beginning before age 15. continuing into adulthood. Some of the treatment for ASPD can be challenging, as individuals may not recognize their behavior as problematic. However, with proper intervention, improvement is possible. Common treatment approaches include psychotherapy, helps develop insight, empathy, and better coping skills. Medication, used to manage aggression, irritability, or co-occurring disorders. Skills training focuses on improving social interaction, emotional regulation, and responsibility. Some of the prognosis for the outlook for individuals with sociopathic personality disorder varies. With consistent therapy, supportive relationships, and a willingness to change, some people can lead more stable, fulfilling lives. However, untreated cases may result in ongoing interpersonal, occupational, or legal difficulties. So it is very important to note that sociopathy behavior has often confused with psychopathy, but the two are not identical. While both fall under antisocial personality traits, psychopathy is typically seen as more innate and emotionally detached, whereas sociopathy often develops from environmental factors. Disclaimer: this information is for educational purposes only and should not replace professional diagnosis or treatment. If you suspect you or someone you know may have this condition, seek help from a licensed mental health professional. Psychology essay/research. Paper version structured, detailed, and formal. Suitable for academic settings. Sociopathic Personality Disorder. Clinical features, etiology, and treatment considerations. Abstract. Sociopathic Personality Disorder, clinically termed Antisocial Personality Disorder, ASPD, is a pervasive condition characterized by a disregard for societal norms, impulsivity, and a lack of empathy. This paper explores the symptomatology, etiological factors, diagnostic criteria, and treatment modalities associated with ASPD. Some follow-up papers are like Introduction to Antisocial Personality Disorder, is a severe and chronic mental disorder defined by persistent antisocial, manipulative, and irresponsible behaviors, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. The condition affects approximately 1-4% of the general population, with a higher prevalence in men than in women. American Psychiatric Association, 2013. Symptoms and diagnostic criteria. Individuals with ASPD typically exhibit failure to conform to lawful behavior, deceitfulness, and manipulation, impulsivity, or failure to plan plan-ahead aggressiveness, and irritability, reckless disregard. For safety, consistent irresponsibility, lack of remorse after harming others for a diagnosis. The individual must be at least 18 years old, with evidence of conduct disorder before age 15. Some of the etiology research indicates that both genetic and environmental factors contribute to the development of ASPD. Twin and adoption studies suggest heritability rates of approximately 40–50%. Reed and Waldman, 2002. Environmental factors such as childhood abuse, neglect, and unstable family environments further increase vulnerability. Neurobiological findings point to dysfunctions in the amygdala and prefrontal cortex, which are involved in emotion regulation and impulse control. Treatment and management. Treatment is complex due to poor insight and lack of motivation for change. Evidence-based approaches include cognitive behavioral therapy, CBT, to target maladaptive thinking patterns, medication management, SSRIs, mood stabilizers for aggression or comorbidities, behavioral interventions that reinforce prosocial behavior. Prognosis depends on early intervention, comorbid substance use, and social support structures. Conclusion: sociopathic personality disorder remains one of the most challenging psychiatric conditions to treat. Given its behavioral and emotional components, continued research into neurobiological mechanisms and early prevention strategies is essential to improve clinical outcomes. American Psychiatric Association, 2013. Diagnostic and Statistical Manual of Mental Disorders, 5th ed. Ree, S.H., and Waldman, ID 2002. Genetic and Environmental Influences on Antisocial Behavior, a meta-analysis of twin and adoption studies. Psychological Bulletin, 128-3, 490–529. 3. Public Awareness article, empathetic, engaging, and educational. Reduces stigma while informing readers. Understanding Sociopathic Personality Disorder. Looking beyond the stereotypes. When you hear the word sociopath, you might picture a movie villain, cold, violent, and calculating. But in real life, sociopathic personality disorder, or antisocial personality disorder, is far more complex, and not every person with this diagnosis fits that image. People with ASPD often struggle with empathy, impulse control, and relationships. They may have a history of breaking rules or manipulating others, not out of pure malice, but because their brains process emotion, fear, and reward differently. Why does people with ASPD poor decision abilities happen? Research suggests a mix of genetic and environmental factors, such as trauma, neglect, or early exposure to violence, can alter brain development. These early experiences can shape how a person sees trust, empathy, and moral responsibility. Can they, in fact, have a sociopath's change inside their head or something? Because treatment is so difficult, but not impossible. Therapy, medication, or brainwashing can make them think better. With these and skills training can help individuals learn self-control, empathy, and better decision-making. Progress often depends on support, consistency, and willingness to engage in the healing process. It's also important to note, not all sociopaths are criminals or violent. Many live quietly, managing their condition while working to build healthier relationships. By understanding the science rather than just the stigma, we can replace fear with awareness and compassion. Mental health is complex, and healing begins with empathy, not judgment.